Hi guys, good morning everybody. Am I audible and visible? Okay, so thank you for tuning in at 10 a.m. today. Tomorrow again we'll try to have the class at 12 p.m. only. Alright, but today's class we have at 10 a.m. Now today is a very important day guys, because I'm going to tell you, I'm audible and visible, right? I'm just going to share the PDF on the group. Today I'm going to discuss all the latest updates also which have been released along with programs, any new update, anything which needs to be remembered for NEETPG as well as FMG. It is for everybody, NEETPG students as well as FMG aspirants. So please listen to the lecture very carefully. We'll be discussing a lot of things, and particularly concerning all the important diseases that can turn up in your exams. Okay, are you all with me? Give me a thumbs up everybody. Give me a thumbs up if you're all with me. Just give me one more second. I'll just start it. Okay, so images, of course we have covered in the image based session, but I will be repeating the image again here today, and I will be repeating anything which is new along with the program. Okay, all right, so let's go to the first, this we've done. So we are on this episode, NHP and diseases. All right, now can you tell me the answer to this? Which of the following is not a form of direct transmission of communicable disease? Like I said, I will be discussing all NHPs today, all national health programs today with updates. If you're not able to revise it now with me, you can revise it later, but do go through this lecture. It is one of the most important lectures of the Sure Shot session. All right, very good. So not a form of direct transmission, it is droplet nuclei. Vertical transmission, contact with soil, droplet transmission, all these are direct form of transmission. Now guys, what is the difference between droplet mode of disease transmission and droplet nuclei? Okay, droplet and droplet nuclei. Remember, droplet is a direct mode. Okay, droplet nuclei is an indirect mode, and when I say droplet nuclei, I also mean it is airborne. Okay, it is airborne. So everything depends on the size of the droplets. Okay, so in droplet infection, the size of droplets guys, the size of droplets, if you see, it is heavier, it is more than 5 micron, and in droplet nuclei the size is less than or up to 5 micron. So droplet particles are heavier. So what happens? They fall to the ground under the influence of gravity. They fall to the ground under influence of gravity, and they travel a distance less than 1 meter. But nuclei, they are lighter particles, so they remain suspended in air, and they travel a distance of how much? More than 1 meter. Clear? And droplet nuclei, you have to remember the diseases which could come by droplet nuclei or airborne, जो एग्जाम में आता है, TB, measles, influenza, chicken pox, COVID. All right, TB, measles, influenza, chicken pox, COVID. This was a favorite AIMS question also. Once upon a time they asked this many times, so I have brought this question and we have discussed it. Go through this table, all the direct modes, all the indirect modes. Now can you see in indirect mode you have a vector borne, mechanical and biological. Please remember, mechanical होता है जिसमें कोई sexual cycle नहीं चल रहा है. ठीक है, वेक्टर में there is no sexual cycle happening, no sexual cycle. All right, no sexual cycle of the agent occurs. But in biological, like housefly in case of typhoid, okay, but biological में, biological vector is the vector in which sexual cycle is happening. Like if you talk about anopheles for Plasmodium falciparum, ठीक है, the parasite that's having a sexual cycle. Clear? Okay, now what I'm going to do is I'm going to take you to a couple of image run. We're just going to quickly name the images, and then we're going to go to the MCQs concerning all the diseases and the programs. So you all know this image guys, this is IDSP, Integrated Disease Surveillance Program, which we have discussed earlier also. I'll just do a run of the logos in one go, and then I will take up individual questions related to the programs, the management part, all of those. Okay, now in this Integrated Disease Surveillance Program, weekly reporting is being done. Please remember, weekly reporting, and there are 3 forms to be filled over here. three forms to be filled. One is SPL, yeah, almost 33 diseases. Syndromic form is the suspect form. Syndromic form is the suspect form. This is being filled, these are forms, this is being filled by the health workers, guys. Then you have the probable forms. The probable form, everybody, is being filled by the medical officers. And of course we have the lab confirmed, which is on the basis of laboratory. Weekly reporting इसमें होता है integrated disease surveillance program. There is for NCDs also we are doing reporting. It is covered under IDSP. उसको बोलते हैं regular periodic survey. कब भी एग्जाम में दिख गया, ठीक है. NCDs के लिए हम लोग जो कंडक्ट कर रहे हैं, what we are conducting, the term given to that is regular periodic surveys for NCDs. Okay, the term particularly given to that is regular periodic surveys for NCDs. Okay, going to a couple of more logos. Just have a look at the names of these logos. The questions related to these will come as we proceed in the lecture. This one is the National Mental Health Program, and today I have also brought slides which will show you the important days that are celebrated, the important incubation period, the communicability period. All of those you will find in the PDF. Now this is National Mental Health Program, in which we rely on district level planning. Okay, and we will see an MCQ related to this. This is National Iodine Deficiency Disorder Control Program. National Iodine Deficiency Disorder Control Program. Deficiency Disorder Control Program, in which we have iodized namak. Okay, per gram of salt at least 40 microgram of iodine is used. This is Poshan Tracker, which is being used by the Anganwadi workers under your ICDS program, and this is Tobacco Control Program. Tobacco Control Program. Alright, Tobacco Control Program. Just a couple of images I'm showing you over here. This one you all know is National Health Mission. I've discussed this before also. The update for this is the name of the program now. It is Pradhan Mantri Samagr Swasthya Mission. Pradhan Mantri Samagr Swasthya Mission. Pradhan Mantri Samagr Swasthya Mission. So that is the first update that you're doing. And इसमें आता है NRHM, इसमें आता है NUHM, इसमें also we get RMNCAH plus N initiatives, all the CDs and all the NCDs. Questions pertaining to that we will see in a while. ठीक है. This you all know, National Vector-Borne Disease Control Program, which protects from 6 diseases. The letter vector has 6 letters, so it protects from 6 diseases. Anopheles क्या transmit करता है? Malaria. Aedes, dengue and chikungunya. Aedes, dengue and chikungunya. Then you have Culex. Culex is lymphatic filariasis. Alright, lymphatic, not Brugian. Brugian filariasis is Mansonia. Lymphatic filariasis, and also you have J. Okay? And one more, Kala Azar or visceral leishmaniasis, which is by Phlebotomus argentypes. Okay? Alright, yeah, Pradhan Mantri Samagra Swasthya Mission. ठीक है, because it's NHM, National Health Mission. That is not Yojana. This one, chikungunya, yeah, I told you, Ixchik, which is a new vaccine which has come for chikungunya. This one, everybody, is NACO, National AIDS Control Organization. Now, NACO started the National AIDS Control Program. Just have a look at this. We'll discuss the MCQ related to this in a while. The headquarter is in New Delhi, and the 4 core groups I want you to remember for HIV, 4 target population, or you could also call it as the core groups. What are the 4 core groups or the target populations that you must remember for HIV, guys? Number 1, which was asked in the latest NICT exam also. Number 1, commercial sex workers. Number 2, men having sex with men. Number 3, injectable drug users. And number 4, transgenders. Alright, transgenders. Don't forget these 4 groups. The 2 other groups, okay, one is the bridge population. Remember, for bridge population we focus on 2 important groups, okay. For bridge population, more important over here is single male migrants, okay, single male migrants and truck drivers. single male migrants as well as truck drivers. They are very important. And for the general population, we go for HIV sentinel surveillance. You all know. For general population, we are using ANC women as proxy indicators. General population, we use ANC women as proxy indicators to extrapolate the prevalence of HIV in general population. This one, however, you all remember, mother to child transmission of HIV. This is not the logo of NARCO. The question of this we will discuss as we proceed in the lecture, that what we have to do in case of a baby who is born to a HIV positive woman. Okay? That we are going to discuss once we go to the MCQs. This one you all know is Suraksha Clinic. This is an initiative of National AIDS Control Program to promote sexual and reproductive health. Please don't confuse it with International Red Cross. International Red Cross may completely red in color with a white dot. Alright, clear. This one, these logos, this is National TB Elimination Program. This is TB हारेगा, TB मुक्त भारत, TB हारेगा देश जीतेगा, ये प्रोग्राम है. ये तुम्हारा है to promote or to accelerate elimination of TB towards 2025. ठीक है. और इसमें we came up with the concept of निक्षय मित्रा, where we are adopting TB patients as our friend. But remember, this one is the logo of the elimination program. You cannot forget that. We want to eliminate TB till 2025. ठीक है. Got it? Okay, all the questions we will be doing. This one you all know is Nikshay. Nikshay is the web-based portal for TB patients. Nikusht is the web-based portal for leprosy patients, and Nishchay is a free UPT kit. This one is DOTS 99. Toll-free numbers are there where the patient is required to call once on taking out the tablet, and this is supposed to ensure the compliance on the part of the TB patient. Okay? Rest of the logos we'll see as we proceed with the MCQs. This one you all know, National Program for Control of Blindness and Visual Impairment. ये पीछे logo Taneja का है, क्योंकि Taneja is the one that promoted or that focused on this one. Nishchay is free UPT kit. Alright, Akshata. Now Taneja is the one that helped in, that is supporting the blindness control program in India. Blindness we have discussed, visual acuity less than 3/60 in better eye with available correction according to the program. According to WHO, it is best possible correction. Okay? This is blindness, available correction. And if you talk about visual impairment, it is visual acuity less than 6/80. Most common cause of blindness and visual impairment, guys, is your cataract. Alright, ocular morbidity is uncorrected refractory errors. If somebody asks you ocular morbidity, it is uncorrected refractory errors. Now let's go to the MCQs. So starting, that was just a quick revision of the images, guys. Now I'm going to take you through all the updates, through the questions on programs related to MCQs. Okay? Just the Ministry of Health and Family Welfare aims to eliminate which disease by 2047. Now this is an update. Which disease by 2047, guys? Which one are we looking for? Sickle cell anemia. TB we were looking 2025. Malaria 2030. Polio, we want to eradicate polio now, the sooner the better, of course. Leprosy मुक्त भारत हमको चाहिए 2027 तक. Leprosy मुक्त भारत by 2027. Alright, 2027 we also want to eliminate 2 more diseases. Eliminate Kala Azar, and we will discuss about Kala Azar and lymphatic filariasis also. Eliminate Kala Azar, eliminate lymphatic filariasis. All these diseases by 2027. ये पता होना चाहिए, guys. Target years for leprosy. And polio is already eliminated. Polio is already eliminated. So we want to eradicate polio. ठीक है? We want to eradicate polio by 1 second. Alright, we want to eradicate polio, the sooner the better. Now have a look at this logo, guys. ये logo आ सकता है. This logo again is an update, like you see. नेशनल सिकल सेल एनीमिया एलिमिनेशन मिशन का ये लोगो है, एंड इन दिस वी आर फोकसिंग ऑन स्क्रीनिंग पीपल विच कुड बी आस्क्ड टू यू इन द एज group of 0 to 40 years. This first point is very important. To eliminate sickle cell, we are focusing on screening. ठीक है. Also, we are providing genetic counseling, premarital. Those are all things that you can read from here. But right now, look at this logo. Look at the year 2047, and we are focusing on screening. ठीक है. That's one of the updates that you must know. Alright, let's see TB preventive therapy. TB preventive therapy में भी एक update है. Anybody can tell me this answer? TB preventive therapy, TPT. The full form is TPT. There is an update over here. Can you tell me the answer to this? For a 10-year-old living in household contact with a known case of drug-sensitive TB, what prophylactic dose could be administered to this child? 6 months rifampicin, 3 months weekly isoniazid and rifampicin, 1 month daily isoniazid and rifampicin, 4 months daily rifampicin. अब यहाँ पे क्या है guys, देखो TPT में I'll take you to the latest see, we always had a TB preventive therapy with a regimen which was not 6 months rifampicin, it was 6 months isoniazid. Alright, it was 6 months isoniazid. We always had this regimen, okay, but now there are certain changes. Now a better regimen than this, alright, better regimen than this 6 months is 3 months isoniazid, 3 months isoniazid plus rifampicin, and this was given as weekly doses दोगे तो all together 12 doses बनेंगे इसमें. ठीक है. अब यहाँ पे 6 months rifampicin choice नहीं है, 1 month of course नहीं है, daily isoniazid. Now look, this is the update guys. 1 month of daily isoniazid and rifampicin will only be given to people living with HIV. That too we are on a trial basis. ठीक है. That too we are on a trial basis, जिसमें 28 doses निकल के आएंगे. Are you understanding? 28 doses. But over here we would prefer what? 3 months of weekly isoniazid and rifampicin, because that is a very more effective regimen. So let me take you to a chart. I am not asking you to ratify all these things. बिल्कुल मत रटना guys. बस एक बार मेरे साथ देख लो. This has come out in the 28th edition of Park textbook, 28th edition Park, and it is very very important that we know this. देखो, target population, people living with HIV, adults and children for more than 12 months. You have a age-old regimen, 6 months isoniazid. You could also give it to infants less than 12 months in contact with TB, active TB. Alright, household contacts below 5 years of age. We can go with any of these regimens. But which is a better regimen? This one. But remember, 3-month weekly isoniazid and rifampicin will be given in only children who are older than 2 years. Exam में अगर question आ गया below 2 years, तब तुम किस में stick करोगे? 6 months isoniazid. Clear? And household contact 5 years and above of pulmonary TB. Again, you can of course give 3-month weekly isoniazid rifampicin or 6 months daily isoniazid. But what is our preference over here? Our preferred regimen is 3 months. Is it clear? Did you understand everybody? But there is one, and this could come in your exam. See, children, adult on silicosis, immunosuppressive therapy, or those who are suffering from silicosis, you can also put them on 3 months of isoniazid and rifampicin. What is the update? The update is that we also have 1 month rifampicin and isoniazid, alright, which is to be given daily, but it will only be given to people living with HIV. Am I clear, everybody? Otherwise, more effective regimen is 3 months isoniazid rifampicin, but that 3 months आप किसको दोगे? For people who are older than 2 years. So exam में question देखना, अगर 1 year 1.5 year old बच्चा है, then stick to 6 months regimen. And also guys, along with isoniazid, what is the vitamin that you give? Quickly in the comment section, what is the vitamin that you give along with isoniazid? What is the vitamin that you're giving along with isoniazid, guys? What is the vitamin that you're giving? Very good, pyridoxine. What is the dose of pyridoxine that you will give? So I want all of you to look at this. This again could next time come as an expected MCQ, where I'm giving you the standard dose of pyridoxine used prophylactically for prevention of neuropathy. Why do you give pyridoxine? You all know deficiency of B6 or pyridoxine leads to seizures and all. Okay? So to prevent neuropathy, guys, what is the dose of pyridoxine that we are given? For children, it is 10 milligram per day. For adults, it is 25 milligram per day. And for adults who are also having HIV, it is 50 milligram. This is important. Okay? TPT important hai, and of course you have this regimen as well. Got it? Give me a thumbs up if you got this question along with the update. And people living with HIV, what is the test? What is the investigation of choice to detect TB? What is the investigation of choice to detect TB among people living with HIV? Investigation of choice to detect TB, guys. You all know it is CBNAT. We will do a question regarding this also as we move forward. Okay, like I said, it has a couple of updates, so please don't pay very good attention to this session today. Alright, this we have done in image, but I wanted to revise again क्योंकि ये आजकल ना ये question float कर रहा है. Floating question पता है, मतलब कभी भी उठ के आ सकता है. So she is Sapna mascot with a school bag. This Sapna mascot has been adopted under the Sparsh initiative, and Sparsh initiative, everybody, is to promote leprosy awareness. ठीक है, leprosy awareness. And Sapna actually was a cured case of leprosy. Sapna क्या थी? Cured case of leprosy थी. Cured case of leprosy. This concept of Sapna was successfully adopted from the concept of Meena. Meena के पीछे एक parrot है. So Meena के पीछे parrot है. This concept was adopted by UNICEF. Meena mascot for child empowerment, child rights. Okay, child empowerment. And you know, if you tell a child that today I will not stop you from doing anything, if I tell my daughter you can have chocolates today, you can watch movies today, you can go to the park all the time, you can meet your friends, you can make phone calls, she will be flying in air today. That's the thing, because I'm not stopping her from doing anything. You can eat ice creams, whatever. So क्या है? Child's right. So जब हमारे rights कोई नहीं रोकेगा, हम उड़ेंगे. ठीक है? So Meena is with the parrot. Sapna, school bag. Got it? So remember these two things which come in the exam. Alright, let's see this one. Health in your own hands is the tagline of which national health program, guys? Again, this logo I have not yet shown. There's an update for that. Health in your own hands is the tagline of which program? National TB Elimination Program, National AIDS Control Program, National Leprosy Eradication Program, National Program on Prevention and Control of NCDs. Now this is the update. What is the update? The update is that the name of the program has changed. Earlier it was NPCDCS. What was it? NPCDCS, which was National Program for Control of Diabetes, Cancer, Diabetes, Cardiovascular Diseases and Stroke. But अब और diseases जुड़ गई हैं, तो because we've got more diseases, we can't keep on adding the names. So we have changed the names. Now can you see this logo? Do this question also. Which of the following diseases are included under the scheme which is represented by the logo given below? So as you can see, health in your own hands. To control NCDs, guys, to control NCDs, all right, the best level of prevention is do not adopt risk factors. Don't drink, don't smoke, don't avoid junk food. So best level of prevention is primordial level. Okay? To control NCD, the best level of prevention is primordial. So over here you can see which diseases are included, guys. Over here, COPD, cancer, diabetes, chronic newer diseases, all right, under this scheme. Now more important I would say over here is we could go by option B. Now guys, option C be technically dekho is not wrong, because now what they have done is, let me just make it clear to you. Let me remove this asthma and let me do one thing over here is, let me write ST elevation MI. Okay. Now see, what I wanted to tell you is that COPD के साथ साथ न्यूअर इंक्लूजन यू कुड ऑल्सो गो फॉर ब्रोंकियल एस्थमा. ठीक है, COPD ब्रोंकियल एस्थमा दोनों कुड बी रिटन, दैट्स ओके. ऑलराइट, COPD ब्रोंकियल एस्थमा वी कुड गो बाय बोथ ऑफ दैट. वी कुड गो फॉर chronic kidney disease. We will go for rheumatic heart disease following rheumatic fever infection. We will also go for non-ST elevation MI. We will also go for non-alcoholic fatty liver. And of course you have got the Ayush modalities. ठीक है, so those are your newer inclusions. COPD, ठीक है. स्ट्रोक तो पहले से ही था. नेशनल प्रोग्राम फॉर स्ट्रोक इज द मोस्ट कॉमन कॉज ऑफ मोस्ट कॉमन मोस्ट मतलब मैक्सिमम डालीज कॉन्ट्रीब्यूटेड बाय कार्डियोवास्कुलर डिजीजेस, जिसमें CAD वगैरह सबसे ज़्यादा आता है. क्लियर? सो यू कुड रिमेंबर दिस वन. इफ़ यू सी COPD, इफ़ यू सी ब्रोंकियल एस्थमा, दैट्स ओके. प्लीज डोंट से ब्रोंकियल एस्थमा इंक्लूडेड है, COPD नहीं, या COPD इंक्लूडेड है, ब्रोंकियल एस्थमा नहीं है, दोनों चलते हैं. गॉट इट एवरीबडी? चलो, सो दिस इज योर NPCTCS. Okay, now the so the name of the program is National Program for Control of NCDs. All right, biological method for mosquito larva control, a 4-star MCQ. They keep asking this, larva को कैसे control करोगे? Nets use करोगे, repellents use करोगे, spray 3 times a month करोगे, Gambusia fish. I am not going to too much detail over here, just wanted to repeat this 4-star MCQ. Gambusia fish is the one which is going to eat the larva. ठीक है. All right, integrated vector management is adopted by NVBDCP to control vector-borne diseases. Which out of the following routes yields permanent results? Now we are discussing integrated vector management. So which one yields permanent results, guys? Indoor residual spray with insecticides, genetic control, source reduction, Gambusia fish, mosquito net, स्प्रेइंग एबेट या टेमेफॉस. एक तुमको आंसर करना है, तो क्या मार्क करोगे? इफ़ यू हैव टू आंसर वन. नाउ रिमेंबर, इंटीग्रेटेड वेक्टर कंट्रोल में यू हैव एंटी लार्वा मेजर्स. ठीक है, लार्वा को जो काउंटर एक्ट करेगा, एंटी एडल्ट, ऑल राइट, जो एडल्ट मच्छर को काउंटरैक्ट करेगा. यू ऑल्सो हैव सर्टन पर्सनल प्रोटेक्शन मेजर्स, ऑल राइट, सर्टन पर्सनल प्रोटेक्टिव मेजर्स. नाउ एनवायरमेंट, एंटी लार्वल में आई हैव गिवन यू अ न्यूमोनिक ECB. ECB में यू हैव एनवायरमेंटल, यू हैव केमिकल, यू हैव बायोलॉजिकल. एंटी एडल्ट you have space spray with insecticides, space sprays, indoor residual spray with insecticides. Personal protection, we are focused on mosquito nets. Clear? Now environmental means, guys, don't let anywhere water collect. So environmental on the other hand refers to source reduction. Source reduction means fill the drains and ditches, don't let water collect, all of that. Okay, so that is going to yield your permanent result. Chemical spraying abate and temephos. We could also spray Paris green, but remember abate more preferred, because Paris green has a little more toxic effect. Okay, so abate is more preferred under the program now, more preferred. And biological also you could use chemical में Paris green, but we prefer abate more. Biological, of course, which one do you use, guys? Gambusia fish. But if you look at those indoor residual spray with insecticides, when do you do a indoor residual spray? When API is between 2 to 5 annual parasite incidents. Genetic control, these are all anti-adult measures. Mosquito nets, of course, is anti-larval. Clear? This is a very important question for the day. Please don't this one. Yes, Shalu. अगर आप source को हटा दोगे, that is which level of prevention? Primordial. If you don't let water collect, if you fill all the drains and ditches, that is which level of prevention, guys? Primordial level of water. Primordial level of prevention. But जब आप insecticide spray करते हो, DDT, malathion, pyrethroids, मच्छर is already there. The adult mosquito is already there. So that is which level of prevention? Primary. Mosquito nets use करते हो. What is happening when you use mosquito nets, everybody? When you use mosquito nets, the mosquito is already there, right? So it is which level of prevention? It is of course your primary level of prevention. Clear? So be very careful with these terminologies. Don't get mixed up. Okay, let's talk about some larva control measures. Let's leprosy. चलो लेप्रेसी तो भगवान हो गए NHP के. लेप्रेसी with its updates, most expected, guys, most expected. Anything and anything from leprosy can come. I will tell you all the updates in leprosy. ठीक है? क्वेश्चन आता है 30-year-old patient presents with 2 hypopigmented hypoanesthetic patches on the back. On slit skin smear examination, no AFP was identified. Which regimen should the patient be started as per National Leprosy Eradication Program? Now I am getting B also, I am getting C also. सबसे पहले तो मुझे ये बताओ guys, which is a very important question, that is it a case of POSI or is it a case of multi? गीता एक बार ले आओ उसको. हेलो बोलो, अब बाय बोलो. बाय बाय. इधर दरवाज़ा खींच दो. चलो तो आंसर क्या था? ऑलराइट, सो नाउ व्हाट डिड यू आंसर? आई मिस्ड योर आंसर्स गाइस. क्या आंसर कर रहे थे आप? Yeah, now guys, there is an update in leprosy program. How do you distinguish, sorry ये तो question ही था, how do you distinguish PBL and MBL, guys? What is the update? How do you distinguish PBL and MBL? How do you distinguish PBL and MBL? What is the update over here to distinguish PBL and MBL? So we are distinguishing in terms of skin lesions, and we are also distinguishing in terms of nerve involvement and slit smear examination. Now if you see POSI bacillary, skin lesions कितना है? If you see POSI bacillary, it could be 1 to 5. Hypoanesthetic, hypopigmented, reddish brown patches. Multibacillary में more than 5, or you can say more than equal to 6 skin lesions. Nerve involvement. What is the new thing over here, guys? If you talk about the nerve involvement, so you should remember when I talk about the nerve involvement, guys, in your POSI bacillary and in your multibacillary, if you talk about the nerve involvement, POSI bacillary no nerve. ठीक है, इसमें क्या होगा? मोर देन इक्वल टू 1 nerve. More than equal to 1 nerve. Clear? Other than this, what you have to remember, guys? Other than this, you also have to remember one more thing. Where are your messages? Yeah, you have to remember slit skin smear examination. Slit skin smear examination. Slit skin smear examination. So if you see in POSI bacillary, no site is positive. Negative at all sites. ठीक है? Negative at all sites. And multi multibacillary क्या है? Positive at one or more sites. Positive at one or more sites. So here now am I clear? Give me a thumbs up if you got this question. पॉसी, ये अपडेट है गाइस, पॉसी बैसलरी कोई नर्व इन्वॉल्व नहीं होगा. दिस इज व्हाट यू आर गोइंग टू फॉलो एवरीबडी. अब यहाँ पे आप देख रहे हो 2 हाइपोपिगमेंटेड पैचेस, हाइपो एनेस्थेटिक पैचेस. अब 2 हो, 3 हो, 4 हो, up till 5 it is paucibacillary. Why is this paucibacillary? No AFB identified. Of course no nerve involvement का तो mention ही नहीं है. So this is a classic case of paucibacillary. And what is the update now in case of paucibacillary? Also we give how many drugs guys? 3 drugs regimen for pauci as well as multi. But what is the duration for paucibacillary leprosy? It is 3 drugs for 6 months. For paucibacillary, the duration of treatment is 6 to 9 months. For paucibacillary leprosy, the duration of treatment is 6 to 9 months. And for multibacillary leprosy, it is how much? 12 to 18 months. अभी सबको समझ आया? Did you all get this question guys? One topic that we are highly expecting in exams is leprosy. Whether you're a NEETPG aspirant, whether you're sitting for FMGE exams. ठीक है guys? Remember, skin lesions, nerve involvement, slit skin smear examination. I had only given you the patches. 2 hypopigmented hypoanesthetic patches. I want a thumbs up everybody. सबको पता होना चाहिए because this is something I'm betting on कि शायद ये आएगा. ठीक है, लेप्रेसी भगवान है अभी MCQ में, तो it is very very important. Now see, another way the question could be asked, can you see over here? Hypopigmented patches, hypo which are seen on the face, trunk extremities with sensory loss due to nerve damage. Nerve thickening हो जाता है. Peripheral nerve thickening with sensory loss indicates nerve involvement. Most common nerve involved you all know is ulnar nerve. I know don't need to discuss that. Sensory deficit is more common than motor deficit. Skin lesion सबसे common, ये आपको दिख रहा है, hypopigmented patches, more specific type hypoanesthetic. Also one more thing, skin biopsy used to confirm. Now if I have to start MDT, do I need all the 3 criterias? नहीं. To start MDT, any one criteria will do. Any one criteria. That means you can check for skin lesions. Either you can start on the basis of skin lesion, nerve involvement or MDT. ऐसा नहीं है कि तीनों क्राइटेरिया होना है, बिल्कुल नहीं. ठीक है, स्लिट स्किन्स में पॉजिटिव आएगा तो ही ड्रग स्टार्ट करेंगे, ऐसा कुछ नहीं है. ओके, यू कैन स्टार्ट MDT ऑन एनी वन क्राइटेरिया. Clear? These are the updates. Don't forget, this was a very important question. This we have already discussed difference between MBL and this one. What is the name of this program? National Leprosy Eradication Program. National Leprosy Eradication Program. And in this, all of you know that if you talk about this lotus flower, this is the patient. If you talk about the sun's rays, all right, sun's का rays, ये क्या है? ये program है. This is the NHP. And if you talk about this hand like this is multi-drug therapy. And leprosy is already eliminated from India. Prevalence criteria आपको पता है, less than 1 case per 10,000 population, which we achieved long back. ठीक है, which we achieved long back. Leprosy मुक्त भारत, already told you 2027. Now just although you can check out from your pharmacology the doses guys, आजकल 2 ही कलर के टैबलेट्स मिलेंगे. पिंक अगर है, दिस इज़ फॉर एडल्ट्स, ऑलराइट, दिस इज़ फॉर एडल्ट्स, MDT मल्टी ड्रग थेरेपी. एंड दिस वन, द ब्राउन कलर, ब्राउन इज़ फॉर बच्चा. ब्राउन यू कैन रिमेंबर, बच्चा, B फॉर बच्चा. तो ब्राउन से हो गया B फॉर बच्चा. बच्चा मतलब हो गया चाइल्ड. ठीक है, बच्चा मतलब हो गया चाइल्ड. हाउ विल यू डिफ्रेंशिएट? नाउ यू कैन सी द रेजिमेन फॉर एडल्ट्स आई हैव गिवन यू. ओके, दिस इज मोर देन 14 years. If you want, you can check out the pediatric regimen from your pharmacology. Rifampicin at 600 monthly doses. Rifampicin is only monthly सुपरवाइज्ड, ओनली मंथली सुपरवाइज्ड डोज जो होता है वो है रिफैम्पिसिन. ऑलराइट, डैप्सोन 100 मिलीग्राम डेली, क्लोफाजिमीन मंथली ऑल्सो एंड डेली ऑल्सो. लाइक ओवर हियर ये 3 टैबलेट क्लोफाजिमीन है, ये 3 क्लोफाजिमीन है, ये 2 रिफैम्पिसिन है. ऑलराइट, एंड दिस वाइट वन इज डैप्सोन. बट इफ you look at the child में, can you see that clofazimine is only on alternate days, it's not daily. So that's how also you can remember clofazimine alternate days for 10 to 14 years. And PBL and MBL 3 drug regimen for both POSI as well as multivascular. Will you give me a thumbs up? Got this? How to identify, how to distinguish between the colors, between the doses, MBL PBL कैसे distinguish होगा, logo क्या है, all this is important for your exam. And this one a go to slide for your exam which I have written, you can read in the PDF also. Most important epidemiological indicator for leprosy program is annual new case detection rate. It should be less than 10 cases per 1 lakh population. If I start surveying every 1 lakh population, I should get below 10 cases. Most important operational indicator, grade 2 disability. Most important health awareness indicator, grade 2 disability. ठीक है, so that you can just read. Prevalence rate is burden of leprosy. Prevalence rate has to be kept less than 1 case per 10,000 population. If you survey 10,000 population, you will find less than 1 case of leprosy. Okay, one more thing, what is the prophylaxis of leprosy? कौन सा drug देते हो prophylaxis of leprosy to stay safe from leprosy? What is the drug that we're giving everybody? Prophylaxis of leprosy again is rifampicin, single dose of rifampicin to all the household contacts, to the social contacts. Okay, so it is a single dose of rifampicin. Alright, let's see your answer to this one. Which of the following intervention is not included in National Strategic Plan for TB elimination? Following intervention is not a part of National Strategic Plan for TB elimination. Universalization of CBNAT for individuals with a cough lasting more than 2 weeks. Implementation of TrueNAT developed by ICMR providing rifampicin resistance result within 1 hour. Introduction of new drug regimens such as bedaquiline and rifampicin. Single dose देते हैं रवि. Zero death, zero disease, zero poverty. Intervention guys, zero death, zero disease, zero poverty is not an intervention. This is a goal that we are targeting, okay, under the plan. Under this we are doing universalization of CBNAT. That means CBNAT to detect rifampicin resistance, any TB suspect, alright, you will do a CBNAT. Any TB suspect, you will do a CBNAT. In India, instead of CBNAT, we use TrueNAT, which gives the result within 1 hour. Obviously, we have introduced new drugs, and there is an update which you all remember, guys. What is the update? The update is for MDR-TB. MDR-TB ka duration is now 6 months. MDR-TB treatment 6 months. Also, you could say rifampicin resistant treatment, which is B-PAL-M regimen. Bedaquiline, predominant, linezolid, moxifloxacin. If the person is resistant to fluoroquinolone, moxi, you will just stick to B-PAL-M regimen, B-PAL regimen. Everything about the regimen has to be done, guys. The side effects of the drug, the doses, to go through it. Okay, all right. Yeah, before that, I hope you remember another update for TB. Another update for TB क्या है? निक्षय पोषण योजना, सबको याद है ना? निक्षय पोषण योजना. What is the निक्षय पोषण योजना now? It is ₹1,000 per month is given as the nutritional incentive. ₹1,000 per month as nutritional incentive to all notified TB patients. To all notified TB patients. Alright, to all notified TB patients. Chalo, going to the next question, a little about cancers. There's a lot of confusion going on. Somebody messaged me, मैम सबसे कॉमन कैंसर इंडिया में क्या है, सबसे कॉमन कौन सा कैंसर मेल्स में सबसे कॉमन है, ओवरऑल इंडिया में सबसे कॉमन कैंसर क्या है. सो आई जस्ट वांटेड टू क्लियर योर डाउट्स. मोस्ट कॉमन कॉज ऑफ कैंसर mortality in India, lung cancer, लिप ओरल माउथ कैंसर, सर्वाइकल कैंसर, ब्रेस्ट कैंसर। सबसे कॉमन कॉज ऑफ कैंसर मोर्टालिटी इन इंडिया क्या है? इट इज़ नॉट लंग कैंसर, इट इज़ नॉट लिप ओरल cancer mortality is also breast cancer. Most common cancer is also breast cancer. This is also, so I'll take you to a slide guys, an updated slide. All right, this is all the updated slide that you can check out over here. Most common cause of cancer, most common cancer cause of mortality in India according to standardized cancer mortality data per 1 lakh population. Okay, breast cancer 13.3. You don't have to remember the percentage, I'm just showing you. Second common is cervical cancer, फिर lip oral, फिर lung cancer. ठीक है, एंड अगर कोई पूछे मोस्ट कॉमन कैंसर इन इंडिया, मोस्ट कॉमन कैंसर इन इंडिया इज ब्रेस्ट कैंसर, देन लिप ओरल कैंसर, देन सर्वाइकल. मोस्ट कॉमन कैंसर इन इंडिया अमंग मेल्स लिप ओरल, देन लंग, देन स्टमक. फीमेल थोड़ा सा इज हिडन, लेट मी डू इट लाइक दिस. Females it is breast, then cervix, then ovary. But yeah, most common cancer in rural India अगर आ गया एग्जाम में, what are you going to mark guys? Most common cancer in rural India. So please remember the most common cancer in rural India, everybody. Rural India. Rural India में the most common cancer is cervical cancer. But what is the question that you can expect? Most common cancer cause of mortality and most common cancer in India is breast cancer. ठीक है, don't get confused, these are very important slides of the day. Okay, how much incentive is provided to individuals in the community who assist in detecting TB cases under the National TB Elimination Program? How much incentive are we giving everybody? Anybody who helps in detecting a case of TB guys, how much incentive are you going to give to anyone who helps you in detecting? Rupees 500. Good. Here I wanted to actually discuss the incentive to treatment providers. All right, treatment providers, anyone can act as DOTS providers. Treatment providers means DOTS providers. So DOTS providers on detecting new and previously treated cases, new and previously treated cases, new on treatment completion, on treatment completion, all right, of new and previously treated TB cases, they will get rupees 1000. On treatment completion of MDR XDR, on treatment completion of MDR XDR, how much? MDR and XDR, they will get rupees 5000, जिसमें they will get 2000 at the end of IP and 3000 at the end of CP. And what about 1000 rupees एक ये है. And what about the private practitioners? Remember, private practitioners on notifying a case of TB to the district TB officers, on notifying a case of TB to district TB officers, private practitioner को कितना मिलेगा नोटिफाइंग करने पे? 500. On notifying treatment completion पे, on notifying on treatment completion पे notify करने पे कितना मिलेगा? rupees 500. So the total incentive to PP is rupees 1000. ठीक है, failure to notify is a punishable offense. Alright, so you must remember this. And Nikshay Poshan Yojana, of course, rupees 1000. Again, these are important slides for your exams. Okay, according to National Framework for Malaria Elimination India, by which year should malaria be eliminated? By which year should malaria be eliminated, guys? Within 30 days, yes. Private practitioner should notify a case of TB, should notify a case of TB within 30 days. All right, very good. Okay, this one you all know, 2030. So I'm not taking too much of time over here. Urban malaria scheme, following measures to control malaria. Which one is urban malaria scheme focusing on? Measurement of API, not AFI, API एंटी लार्वल मेजर्स, एंटी अडल्ट मेजर्स, एक्टिव सर्विलेंस. सो हम लोग अर्बन मलेरिया को कंट्रोल करने के लिए किस पे फोकस्ड हैं? एंटी लार्वल मेजर्स पे. रूरल मलेरिया को एंड आई हैव ऑलरेडी टोल्ड यू व्हाट आर एंटी लार्वल, व्हाट आर एंटी अडल्ट. रूरल मलेरिया को कंट्रोल करने के लिए वी आर फोकस्ड ऑन एंटी अडल्ट मेजर्स. एंड एंटी लार्वा अर्बन एरियाज. Urban areas में which is the species of Anopheles that you can find. So in remember in urban areas it is living with us. So us मतलब Anopheles us मतलब हो गया Stephensi. Anopheles Stephensi. And what about rural areas? What about rural areas? So in rural areas it is Anopheles Culicifaces. Culicifaces. In case कोई पूछ लिया. ठीक है. Going to the next one. In an area with API more than 2, if vectors are refractory to DDT, what are you going to spray? You always have to do a vector control. So you calculate API. Now if API is more than 2 and DDT is not acting, what will you do? So see, any area that has API more than 2, what do we start with? We give 2 rounds of DDT at 6 weeks interval. At 6 weeks interval guys, during transmission season. During transmission season. ठीक है. During transmission season. अगर vector DDC से refractory है, alright, refractory to DDT, then we shift to what? We shift to 3 rounds of malathion. 3 rounds of malathion. Again 6 weeks intervals during transmission season. If it is refractory to malathion, we shift to 2 rounds of pyrethroids. We shift to 2 rounds of pyrethroids. The important thing is transmission season. Transmission season होता है July to November. मलेरिया मंथ कब सेलिब्रेट होता है? मलेरिया मंथ नेशनल मलेरिया मंथ विच इज सेलिब्रेटेड इन इंडिया इज जून. ऑलराइट, नेशनल मलेरिया मंथ, इट इज सेलिब्रेटेड इन इंडिया इन द मंथ ऑफ जून. सो वी स्टार्ट डूइंग दिस इन दिस. और API 2 मोर देन 2 है, देन वी आर डूइंग. बट इन एरियाज वेयर API इज लेस देन 2 गाइज, यू विल जस्ट डू अ इंडोर रेसिडुअल स्प्रे विथ इंसेक्टिसाइड्स. ओके, API लेस देन 2, किसी भी एरिया में जहाँ API is less than 2, you will just do a space spray with insecticides. Whenever space spray with insecticides, whenever a case of Plasmodium falciparum is reported. Remember that if the API is less than 2. More than 2, you will do a indoor residual spray. और API अगर 2 to 5 है, we will use conventional nets. We will use conventional nets. But if API is more than 5, we will use long lasting insecticide treated nets जिसका shelf life 3 years होता है. That has chemical binders also attached to it. Deltamethrin, cyflutrin, all those things. ठीक है. So you should know where we are doing a space spray and where we are doing a indoor residual spray. All of that depends on API का value. ठीक है. All are true about rapid diagnostic test used for diagnosis of malaria except rapid diagnostic kit that we use for malaria. All are true about that except, what is your answer over here? It is used to detect PF. It gives results in 6 to 10 minutes. It is also known as dipstick test. It is based on histidine rich protein 2 antigen detection test. Now field में we do use a rapid diagnostic test. This rapid diagnostic test, which is based on histidine rich protein 2, is only detecting PF. It is also known as dipstick. It doesn't give result in 6 to 10. 6 to 10 minutes बहुत देरी हो गया. ये result दे देगा 3 minutes में. ठीक है, 2 to 3 minutes के अंदर it gives your result. Ronak got this question correct. Most of you ended up making a mistake over here. It is known as dipstick test. You also have another test guys, optimal test. This is to detect PF and Plasmodium vivax both, and this is based on lactate dehydrogenase. ठीक है, lactate dehydrogenase. But rapid diagnostic test that we use in the field guys, it is also known as dipstick test, which is based on histidine rich protein. ठीक है, चलो, a public health specialist was studying Plasmodium species and decides to visit malaria endemic place after 2 days to do his study for 4 weeks. Which of the following drugs need to be taken as prophylaxis before visiting the malaria endemic region? Now we are going to a malaria endemic region, so we are risk of malaria. So prophylaxis over here, prophylaxis का मतलब क्या हो जाएगा? Prophylaxis again would mean your primary level of prevention. So it is a short term prophylaxis. Short term prophylaxis, you are traveling for less than 6 weeks. So the distance A to D is short. What are you going to do? Doxycycline. If you are traveling long term prophylaxis more than 6 weeks, you will take A to M. The drug of choice is going to be what, guys? Mefloquine. Okay. Also I have mentioned the doses over here. You can read this. Prophylaxis में if you talk about the dose, doxy is 100 milligrams. Start 1 to 2 days before travel. Continued for 4 weeks post travel, guys. And for Meflo, it is 250 milligram weekly, not daily, which is started 2 to 3 weeks before travel and continued for 4 weeks post traveling. This is important. Short term prophylaxis, long term prophylaxis. Okay. Tell me the answer to this. Patient coming from Bihar, Plasmodium falciparum positive, what is the drug of choice? Patient is coming from Bihar, PF is positive, what is the drug of choice? Bihar northeastern state है या other state है? Put in the comment section. क्या है तुम्हारा drug of choice? Now Bihar is not a northeastern state, it is an other state. So you all know for Plasmodium falciparum, it is ACT. Artemisinin combination therapy. If you talk about other states, it is ACT, SP, sulfadoxine pyrimethamine. Yes, very good there. ACT, SP, Dipanshu, that's good. And if it is northeastern state, it is ACT, LM, artemether lumefantrine. Plus हमने को क्या ऐड करना है? Primerquine. So here he is coming from Bihar, so I am going to stick to ACT, SP. Alright, but I have made a chart for you guys. This is treatment of malaria. This is your go-to chart. You do get question on this. Anybody who is Plasmodium vivax या ovale, drug of choice is chloroquine. You give it for 3 days and Primerquine for 14 days along with the doses you can see over here. Chloroquine को भी आपको 3 days में बांटना है 10, 10 and 5. Plasmodium falciparum, of course we have ACT. In northeastern states it is artemether plus lumefantrine. Single dose and Primerquine आप दोगे day 2. Plasmodium falciparum in all other states, ACT of course, artesunate for 3 days plus sulfadoxine on day 1, pyrimethamine on day 1 and Primerquine. Primerquine you usually add on day 2. So in case your pharma teacher has told to go through the doses, I have put out all these doses for you. Okay, which is for you. And mixed infection, very good. What is given in mixed infection? Somebody asked. किसने पूछा mixed infection ना? Yeah, Achal, that's right. So I've written it for you. Mixed infection, region specific ACT plus Primerquine for 14 days. That is what we give for mixed infection. Okay. And pregnancy, all of you know Plasmodium falciparum अगर pregnant है, pregnancy. First trimester you're going to give quinine. First trimester quinine. Second and third trimester everything same ACT. अगर other states है, if it is other states, ACT, SP. And if guys it is northeastern state, it is ACT, LM. But always remember in pregnancy Primerquine is contraindicated. Okay? So I have given you the doses for leprosy, I have given you the doses for malaria drugs, TB drugs pharma से dose देख लेना guys याद से. ठीक है? Okay, now a couple of questions regarding some other diseases guys. Half an hour more we are going to take. Filariasis and Kala Azar, a couple of more questions with them as well. Identify the correct statement regarding the elimination of lymphatic filariasis according to elimination of lymphatic filariasis program. WHO recommends dual therapy with albendazole and ivermectin for elimination of transmission. Target set for India is 2025. Considered eliminated when number of microfilary carriers is less than 5%. Considered eliminated when children born after initiation of this one. Yeah, so over here WHO recommends dual therapy. No, we know for mass drug administration it is now 3-drug regimen with albendazole, ivermectin and DC. All the 3 drugs are being given. ठीक है, and national set target set is 2027. Now we are looking towards 2025. No, 2027. Considered eliminated when number of microfilaria carriers is less than 5%. No, less than 1%. So this is correct. It is considered eliminated once we've started the program. You should not find any adult filarial worm in the body. One more question that comes from filariasis. All of you know the vector for filariasis. Can you quickly tell me the vector for lymphatic filariasis? Agent पता है ना, Wuchereria bancrofti, वो तुम पढ़ोगे. The difference between Wuchereria bancrofti and Brugia timori from your microbiology, how to identify them, you should do it. Vector for filariasis you all know is Culex. ठीक है, Culex quincke F fasciaticus, it has the F letter, या Culex fatigans, कुछ भी बोल सकते हो. ठीक है. Now another question that comes from filariasis, these are all one-liners, very important for filariasis. If somebody asks you which is the most common method you will use for epidemiological assessment of filariasis, we will prepare a thick film, blood film, between 8:30 PM to 12 midnight. You can also collect up to 2 AM. But if somebody asks you most sensitive method for detecting low density microfilaremia, don't say preparation of thick blood film, it is membrane filter concentration method. Now रात में हमेशा blood film prepare करना possible नहीं है, so we do a DEC provocation test. Do you know about this DEC provocation test? What is it? You can microfilaria can be induced to appear in the blood during daytime, and blood is examined 30 minutes after, not usually 1 hour. You can examine any time within 30 minutes. ऐसा भी नहीं है कि तुरंत ही एग्जामिन करो, but within 30 minutes you should examine. ठीक है, give 100 milligram. That was for lymphatic filariasis. Now of course let's quickly do a couple of questions regarding one more disease. A patient reports a fever of 1 week duration and complains of abdominal distension, loss of appetite, lymphadenopathy. The patient is responding poorly to antibiotics, antimalarial. The patient underwent a Vidal test which was negative, but RK39. This RK39 is Kala Azar. Kala Azar is the same as, guys, visceral leishmaniasis, and all of you know phlebotomous argentypes. The vector is phlebotomous argentypes. The vector is phlebotomous argentypes, guys. ठीक है, अब ये RK39 buzzword है एग्जाम में, and it is liposomal amphotericin B. And in case, guys, liposomal amphotericin B doesn't work, what is my alternate drug? What is my alternate drug? It is miltefosine plus paramomycin. Miltefosine plus paramomycin. ठीक है, पोस्ट कालाजार डर्मल लीशमेनियासिस तो मिल्टोफोसाइन है. ऑल्टरनेट ड्रग इज मिल्टेफोसाइन प्लस पैरामोमाइसिन. अदरवाइज यहाँ पे सिंगल डोज इन्फ्यूजन ऑफ लाइपोसोमल एम्फोटेरिसिन बी कर लोगे. कालाजार वी आर वांटिंग टू एलिमिनेट टिल 2027. ऑल्सो यू हैव elimination strategy. Yes, of course, Neha. Strategy, elimination criteria for Kala Azar, which is less than 1 case per 10,000 population. This is the same as leprosy. Elimination criteria for Kala Azar. Clear? चलो, which of the following is natural reservoir for J? J you will revise the life cycle as well, guys. Natural reservoir for J, आंसर क्या दोगे? Which of the following is a natural reservoir for J? Okay, we need to speed up a little bit, so I'll be speeding up a little because at the end I have mostly all the charts to show you. So yeah, Japanese encephalitis, natural reservoir, everybody knows as ardite birds. Cattles, you know, are mosquito attractants. Cattles, you know, are mosquito attractants, guys. Pigs are the amplifier host. They maintain viremia. Ardite birds are the natural reservoir. Humans are the dead end host. Dead end host or accidental host. Vaccines we have already discussed, तो वो आपको कर लेना है. सपना mascot already discussed. पुनीत अभी क्या था? This is your J life cycle. We have discussed it n number of times. Just revising it. You can have a look over here. The only animal which shows symptoms, guys, please remember, horses. Only animal which shows symptoms. only animal which shows symptoms. All right, horses is the only animal which shows symptoms. You must remember that as well. ठीक है, चलो. इन AFP पैरालिसिस, ओके, AFP इज अ ओल्ड टॉपिक बट कभी कभी एग्जाम में आ सकता है. रिवाइज कर लेते. लेट मी 1 second. Yeah, can you tell me the answer to AFP paralysis? In AFP paralysis, surveillance for children aged polio. Now we have a polio endgame eradication strategy going on. ठीक है, so आपको पता करना है true statement. Only one stool sample is required to be collected within 30 days. No, we don't need one stool sample, guys. 2 stool samples, and the size of the stool sample, the weight has to be, it's like the size of a thumb. The weight is 8 gram. And how do you transport the stool samples, guys? I hope you remember reverse cold chain. You are transmitting it in red carriers. The temperature required to maintain is the same as that of vaccines. Stool samples must be sent to district hospitals. Nahi, National Institute of Virology, Pune. Samples can be collected up to 3 months after onset of paralysis. No. The correct statement I asked, which most of you said, 2 stool samples collected 24 hours apart, ideally within 30 days, 14 days of paralysis onset. So I'll just show you one slide over here, just to read it. 2 stool samples are collected 24 hours apart, ideally within 14 days of paralysis onset, and acceptable up to 60 days, but the best answer is 14. Transmitted to NIV Pune within 72 hours. ठीक है, और पोलियो केस का कन्फर्मेटरी रेसिडुअल पैरालिसिस आप चेक करते हो 60 डेज पे. रेसिडुअल पैरालिसिस यू आर गोइंग टू चेक विद इन 60 डेज. कन्फर्मेशन यू कैन गिव टिल 90 डेज. ओके, एंड वन मोर थिंग ओवर हियर दैट you should remember, guys, is that is the AFP surveillance going on well? So you must be able to find out more than one case of non or of AFP per 1 lakh population. If you survey, you will get more than one case of non-polio AFP. Basically वो क्या हो सकता है? GBS, transverse myelitis. ठीक है, 1 lakh population. Diagnosis 90 days. AFP हो गया. चलो, quickly tell me the answer to this. A person is HIV positive. Most common opportunistic infection is TB. Sputum AFB for the patient is positive. In case of HIV TB co-infection, what is the best line of management? So we've done this many times. Any person who is living with HIV, you're going to do a CB NAT. If they are positive, you will start ATT followed by ART after 2 weeks to prevent immune reconstitution syndrome. To prevent immune reconstitution syndrome. Immune reconstitution syndrome. इसको हमें prevent करना. And TPT I have already discussed. Okay, in case of accidental exposure, the accidental exposure, post-exposure HIV prophylaxis should be started immediately. It is best within how many hours? Best within 2 hours, 48 hours, 72 hours, 4 hours. Best within पूछा है, best within. Nobody gave the correct answer till now. You can give it till 72 hours. It is immediately, started immediately, best within 2 hours. That's how they will confuse you in the question. You can give given till 72 hours. Okay, given till 72 hours. But it is best to start it within 2 hours. You all know TLD, tenofovir, lamivudine, dolutegravir, to be given within 72 hours. Alright, and it has to be given till 28 days. Accidental needle prick injury. Okay. Okay, Asbels has been initiated for which of the following disease? Especially a term Asbels, guys. Asbels is a term. ASHA based surveillance for what is your answer? ASHA based surveillance. Asbels क्या है? ASHA based surveillance. Yes, ASHA based surveillance for leprosy patients. Surveillance for leprosy patients. ठीक है, particularly when she is going looking for leprosy cases, the term is Asbels. Alright, Asbels. Okay. और अगर एग्जाम में आ गया, आशा इज़ यूजिंग अ कम्युनिटी बेस्ड असेसमेंट चेकलिस्ट. ये किन डिजीजेस के लिए? कम्युनिटी बेस्ड असेसमेंट चेकलिस्ट. इफ दे गिव यू व्हाट इज शी covering in this checklist? What is she asking people? She's taking information on TB and particularly she's taking information on NCD, जैसे डायबिटीज़ हो गया, हाइपरटेंशन हो गया, ऑल दीज थिंग्स, ठीक है. सो आशा बेस्ड सर्वेलेंस फॉर लेप्रेसीज एस्पल्स, कम्युनिटी बेस्ड असेसमेंट चेकलिस्ट इज TB. ये फॉर्म्स होते हैं जो वो फिल करा रही होती है. अनमोल इज अ tablet based software for ANMs. The data is updated on Anmol. Okay. Alright, which of the following indicators of obesity obtained by dividing weight in kg by square of height in meters? So we all know this, guys. Obesity indicators. As quick as possible, can you tell me weight in kg upon height in meter square is the same as Quetelet index. Height independent obesity indicator is which one? इनमें से हाइट इंडिपेंडेंट ओबेसिटी इंडिकेटर क्या है? ये आता है एग्जाम में, हाइट इंडिपेंडेंट ओबेसिटी इंडिकेटर. इफ एनीबडी आस्क्स यू, हाइट इंडिपेंडेंट ओबेसिटी इंडिकेटर इज कॉर्पुलेंस इंडेक्स, actual weight upon desirable weight, and the cutoff is 1.2. okay, more than 1.2 is obesity. So this you can read from your LRRs also. Which of the following is false regarding National Program for Control of NCDs administrative setup? Can anyone tell me? This is something that we can expect, guys, because NCDs is on the rise, okay, and contributes the maximum daily. Anyone can come up with the answer over here? I just wanted to show you the this one, the question over here. देखो guys, CHC level में हमारे पास रोगी कल्याण समिति होता है. Those are like welfare organization, trust hospitals, ठीक है. सब सेंटर वी हैव विलेज हेल्थ न्यूट्रिशन सैनिटेशन कमिटी. विलेज हेल्थ कमिटी हमेशा सब सेंटर में होता है. दे ऑर्गेनाइज विलेज हेल्थ न्यूट्रिशन सैनिटेशन डेज ऑल्सो. डिस्ट्रिक्ट हॉस्पिटल यू विल हैव अ डिस्ट्रिक्ट NCD cell. Tertiary level we don't actually talk about national. National NCD level is at center level. This is at central level. At tertiary level you have medical college and SSH. It was just जो हम लोग levels of health care पढ़ते हैं ना, उसके basis पे question बनाते हैं. Okay, and you should remember that opportunistic screening for NCDs also start from subcenter and PHC level. Any person who is above 30 years, we will do a opportunistic screening for NCDs. Okay, these are type of questions that can confuse you. CHC में ये word देख लो, रोगी कल्याण समिति are like wellness समितिस, trust organizations, okay, which is ensuring that hospitals are running well. Sub center में हमेशा village health nutrition sanitation committees होता है. National cells are present in central level. Okay, which among the following is not part of steps approach by WHO? As quick as possible, guys, I just have 15 minutes. Can you quickly mark this? Which among the following is not part of steps approach? Steps approach क्या होता है? Surveillance of risk factors for NCDs. Surveillance of risk factors for NCDs. Okay, risk factors for NCDs. That is your surveillance approach. So of course we're not taking blood grouping here. In questionnaire we'll fill lifestyle behavioral factors. In physical measurements we'll take anthropometry. In biochemical we'll take lab measurements. Physical measurements में तुम anthropometry लोगी और questionnaire में आप क्या भरोगे? Lifestyle behavioral risk factors. Lifestyles behavioral risk factors. Those are your questions over here. Clear? Okay, all are modalities to prevent hypertension. Anybody except, what is your answer here? Prevent hypertension. Right now hypertension has not started. Dash diet, exercise for 30 minutes most days of a week, reduction in salt intake, early diagnosis and treatment. Hypertension को रोकने के लिए क्या नहीं है यहाँ पे? Very good, simple. Early diagnosis and treatment तो screening है ना, which is secondary level of prevention. Secondary level prevention, disease has already started, right? And we're going to see that. Alright, keep monitoring blood pressure. Now guys, to prevent hypertension, please note this slide. This is important. Prevent hypertension, we follow a DASH diet. Dietary approach to stop hypertension. It lowers systolic BP. All of these modalities will lower systolic BP by 8 to 14 mmHg. वेट रिडक्शन करोगे देन पर 10 kg वेट लॉस सिस्टोलिक बीपी इज लोअर्ड बाय 5 to 20 mmHg. दिस इज इंपॉर्टेंट गाइज, इट्स फ्रॉम योर पार्क टेक्स्ट बुक, दिस इज इंपॉर्टेंट. ठीक है, पार्क टेक्स्ट बुक से. अल्कोहल no more than 2 drinks per day, lower systolic BP by 2 to 4 mmHg. Sodium reduction 5 gram ही लेना चाहिए, 2 to 8 mmHg. Physical activity lower systolic BP by 4 to 9 mmHg. More than 30 minutes per day for most days of the week. So they could ask you hypertension prevent करने के लिए सबसे ज़्यादा what is like lowering the systolic BP most guys, it is if you see over here dash diet, because वेट रिडक्शन पर 10 kg वेट लॉस है, इसको पढ़ के जाना. इफ़ यू कैन इट इज़ वेरी गुड. आंचल डाइट हमेशा बहुत इंपॉर्टेंट होता है 8 to 14. ठीक है, रेस्ट ऑल इन द वैल्यूज ऑफ 2 to 8 एंड ऑल दैट. फिजिकल एक्टिविटी जस्ट गो थ्रू इट मी वंस इन द स्लाइड इन केस इट टर्न्स अप, यू विल बी हैप्पी. हेडन्स मैट्रिक्स अप्रोच किसके लिए है, विच व्हाट डिजीज इज इट टॉकिंग अबाउट, जस्ट गिव मी द नेम ऑफ हेडन्स मैट्रिक्स अप्रोच. व्हाट इज द नेम ऑफ दिस अप्रोच, दिस वाज वंस आस्क्ड यू नो इन DNB एग्जाम, जब पेपर अलग होता था DNB का, दे आस्क्ड दिस एंड दिस इज ऑल्सो गिवन इन योर टेक्स्ट बुक ऑफ पार्क. हेडन्स अप्रोच किसके लिए होता है, वेरी गुड, इंजरी एक्सीडेंट्स, दैट्स गुड, इंजरी एक्सीडेंट्स, all right, you have Hayden's approach. ठीक है, and I'm sure you all have read about it. This is Hayden's approach. एक बार देख लो just in case this image turns up. Pre-injury, injury, post-injury. What are the measures directed towards the victim person, agent, vehicle, and environment? It's like agent, host, environment. All right, for NCD. So we are not discussing this in detail, but you should know the name Hayden's matrix. All right, next, which among the following is the most common cause of preventable blindness in adults? Preventable blindness, treatable blindness keeps coming in exams. So can you tell me the answer to this? Which of the following is the most common cause of preventable blindness in adults? फिर ध्यान से सोचो, मैंने आपको ये पढ़ाया है, वी हैव डिस्कस्ड इन LRRs, RRs. गाइज एडल्ट पूछ रहा है, व्हाई आर यू मार्किंग विटामिन ए डेफिशिएंसी? विटामिन ए डेफिशिएंसी इज प्रिवेंटेबल एंड ट्रीटेबल ब्लाइंडनेस इन चिल्ड्रन. गुड, वी डिस्कस दिस. कैटरैक्ट प्रिवेंटेबल नहीं होता है, कैटरैक्ट ट्रीटेबल ब्लाइंडनेस है. Cataract is treatable blindness in adults. Cataract is treatable blindness in adults. Trachoma is preventable blindness in adults. जिसमें you talk about which one? Infective trachoma. What do you use for infective trachoma? The safe strategy. Surgery, antibiotics, facial cleanliness, environmental hygiene. ठीक है, सो डोंट गेट कन्फ्यूज. दिस वॉज अ क्वेश्चन विच यू शुड. मोस्ट कॉमन कॉज ऑफ ब्लाइंडनेस, मोस्ट कॉमन कॉज ऑफ विजुअल इम्पेयरमेंट, ऑल दीज थिंग्स, प्रिवेंटेबल, ट्रीटेबल, डेफिनेशन ऑफ ब्लाइंडनेस, कौन सा ऑर्गेनाइजेशन ब्लाइंडनेस में हेल्प कर रहा है, एनीथिंग कैन टर्न अप फॉर this exam. Okay, all right, what is the primary objective of national mental health program in India? Guys, I told you, I showed you the logo, that's the sunflower. So what is the primary objective over here? Establish new psychiatric hospitals, integration mental health care into general health care service, increase the number of psychiatrists in urban area, provide only institutionalized care for psychiatric patients. So what are we doing? I told you national mental health program, we are focusing on its implementation at the district level. So what we will do, not making new hospitals. लोग ऐसे ही hospital नहीं जाते. We want the services to reach to the people at the community. So mental health has to become a part of community, guys. In general healthcare services, we should try to integrate mental health care. Mental health care में IQ पढ़ के जाना, guys. That from your psychiatry you can study, or in RR videos you will find level of intelligence IQ के basis पे क्लासिफिकेशन पढ़ के जाना. ऑल्सो मेंटल हेल्थ का लोगो देख लिया हमने, एंड वी ऑल्सो लर्न अबाउट द डिस्ट्रिक्ट लेवल ऑफ इम्प्लीमेंटेशन फॉर द मेंटल हेल्थ प्रोग्राम. Okay, under targeted interventions of for HIV, which group is not covered, guys? Under targeted interventions, what is targeted interventions? Targeted interventions होते हैं the specific group of interventions that we are delivering to the patients. Okay, the specific group to the high risk groups. So what is it, guys? Targeted, which group is not covered? कौन सा ग्रुप रिस्क में नहीं है, सोचो. कौन सा ग्रुप रिस्क में नहीं है? नाउ आर इंडस्ट्रियल वर्कर्स एट रिस्क? एवरीबडी. वो किसके रिस्क में है? अगेन थिंक अ लिटिल. इंडस्ट्रियल वर्कर्स आर एट रिस्क ऑफ ऑक्यूपेशनल डिजीजेस, न्यूमोकोनियोसिस विच विल डू टुमारो. ऑल ऑफ देम आर एट रिस्क यहाँ पे, ठीक है, बट यहाँ पे तो नहीं है वो, है ना. फटाफट से स्ट्रीट चिल्ड्रन लगा दिया. स्ट्रीट चिल्ड्रन कैन इंजेक्ट थिंग्स. ओके, यू विल नोटिस, रीड आर्टिकल्स, यू विल. इंडस्ट्रियल वर्कर्स, pneumoconiosis. Okay, what is the major challenge to achieving universal health coverage? What is the major challenge to achieving universal health coverage? Anybody can come up with the answer over here. और इंडिया में कौन सा प्रोग्राम यूनिवर्सल हेल्थ कवरेज आपको प्रोवाइड कर रहा है? व्हाट इज द इंजेक्टेबल से स्ट्रीट चिल्ड्रन रिस्क में है, ठीक है नित्या. ऑलराइट. In inequalities and distribution, adequate support and access to quality assured products only in low income settings. Purpose of UHC is to find a balance between countries' income, health provision and financial burden. ठीक है. What is the major challenge बोल रहा है? Okay, to provide healthcare to everyone regardless of the country's income. UHC only deals with financial aspect of healthcare and cannot cover health provisions for all. नहीं, देखो, UHC deals with financial aspects. It is covering the health. Challenge क्या है? सबसे important, balance ढूंढना country के income, health provision and financial burden पे, ठीक है. And to provide that balance, we need to find, guys, between country's income, health provision as well as financial burden. Alright, now to provide healthcare to everyone, we are trying to stress on that. And in India, what is the program which is focusing on that? You all know it is Ayushman Bharat. Ayushman Bharat के बारे में you should study each and every point which has been discussed in our image based session. ये logo आ सकता है. What is this logo that you see over here? Can you put in the comment section the logo of this is? ये logo Ayushman Bharat नहीं है. Actually these are showing your health and wellness centers. Okay, financial coverage of 5 lakh per person per family per year. Number of family members and age is no restriction. Health and wellness centers, ठीक है. PMJ scheme, yes, rupees 5 lakh per family per year, that we have already discussed. Age and number of family members is no restriction. We are also providing RMNCAH plus and facilities. Okay, which parameters used to assess the efficiency of malaria surveillance under the program, guys? Efficiency of malaria surveillance under the program. What do you want to answer to this one? Efficiency of malaria surveillance under the National Vector-Borne Disease Control Program. Number of family members and age is no restriction. Good. Annual blood examination rate. Is the program going on well? So what is this? This is out of the total population, how many blood slides examined? How many blood slides examined? ठीक है. Multiply करोगे with 100. Operational efficiency of the program. Here the word is actually operational efficiency. And what is the program targeting? The ABER should be more than 10%. Annual parasite index बोलो, incidence बोलो. This is a measure of burden of malaria. Burden of malaria. And on the basis of API, guys, we frame our elimination strategies. अभी पढ़ाया था मैंने आपको API less than 2, 2 to 5. So on the basis of that. API क्या होता है? API होता है out of the total population, ठीक है, new cases, number of cases positive for, number of cases positive for plasmodium or malarial parasite, but of course you have to multiply with 1000. Slide positivity rate is calculated during an outbreak. Okay, out of the total slides positive, okay, out of the total slides examined, how many are positive? Out of the total slides examined, how many slides are positive? ठीक है, for malarial parasite. But if somebody asks you what is the index for recent transmission of malaria, most sensitive index for recent malaria transmission, what are you going to mark? Most sensitive index guys for recent malaria transmission, क्या है आंसर? Most sensitive index for recent malaria transmission, can anybody tell me in the comment section? Yes, that is infant parasite rate. How many infants are showing positivity for malarial parasite? Infant positive rate, okay, most sensitive index for recent malaria transmission. Spleen rate is endemicity of malaria. Spleen rate, children 2 to 10 years of age showing enlargement of spleen. So endemicity of malaria is your spleen rate. ठीक है, all right. Okay, now we'll do pneumonia, rabies, diphtheria management, and then I'll just show you a couple of slides. 24-month-old, weighing 11 kg, presents with a respiratory rate of 38 per minute and chest in drawing. What is the most appropriate step in the management? Now you always have to remember that when nothing is mentioned, we will consider according to IMNCI management, where we have a color-coded management. 24 months मतलब 2 months to 5 years का क्लासिफिकेशन पे जाना है, ठीक है. नाउ इफ देयर इज नो चेस्ट इन ड्रॉइंग, नो फास्ट ब्रीदिंग, नो न्यूमोनिया. बट इफ चेस्ट इन ड्रॉइंग एंड और फास्ट ब्रीदिंग इज देयर, ठीक है, अगर चेस्ट इन ड्रॉइंग है, ऑलराइट, इफ देयर इज चेस्ट इन ड्रॉइंग and or there is fast breathing, 2 months to 5 years is going to be pneumonia. Which color are you going to put him in? You will put him in yellow color. What do you mean by yellow color? That means the baby will get OPD या medical treatment, ठीक है, and return to follow up in 2 days. But if the baby has danger signs, 2 months to 5 years, danger signs in 2 months to 5 years is severe pneumonia, where you will give the first dose of syrup amoxicillin पिला के refer to CHC where there is a pediatrician. Now here respiratory rate 38 per minute. Is it fast breathing? So you should know the criteria for fast breathing guys. If you talk about, you have a rule of 60 50 40. What is 60? Up to 2 month. अगर कोई बच्चा 2 month old है, respiratory rate of more than 60 breaths per minute is fast breathing. 2 to 12 months old है, respiratory rate more than 50 breaths per minute, and 1 to 5 years old है, respiratory rate more than 40 breaths per minute is fast breathing. So here it was 38 and he is 24, 2-year-old. So is it fast breathing? No fast breathing, but the baby is having chest and drawing. So what will you do? What are you going to do guys? आप इसमें क्या करोगे? What did you give your answers as? Why have you referred the baby? Does the baby have any danger signs? कोई danger sign है या नहीं? The weight is also okay, 11 kg, 2-year-old, that's completely fine. What should you do? Give the baby oral amox for 5 years. Danger signs is stridor in a calm child, seizures in a baby, cyanosed baby, alright, all those are danger signs. Lethargic baby, convulsions आ रहे हैं, वो सब danger signs होते हैं. यहाँ पे the baby is a simple case of pneumonia. For less than 2 months it is no pneumonia, severe pneumonia, very severe pneumonia. So less than 2 months में severe and very severe you have to refer, but over here in pneumonia it is yellow. Where will you refer to CHC? Severe pneumonia, वो किस color में जाता है? Pink color. So here you will simply give oral amox and you can just send the baby home and ask him to come back for in this one. Got it everybody? Urgent referral कहाँ पे होगा? For if it is a case of less than 2 month old, severe pneumonia, very severe pneumonia. Syrup, not injections, syrup amoxicillin. Project Monica is associated with the study of which diseases guys? Project Monica is monitoring trends of cardiovascular diseases. Quickly tell me the answer. This is cardiovascular, monitoring trends of cardiovascular diseases. Okay. One more thing guys, I just want you to know, देखो कोहॉर्ट स्टडी का 2 एग्जाम्पल याद रखना. कोहॉर्ट स्टडी, वन इज फ्रेमिंगम हार्ट स्टडी, वन इज फ्रेमिंगम हार्ट स्टडी, Framingham Heart Study, and also Dolls and Hill. Dolls and Hills is not a case control study, guys. Dolls and Hills study is a cohort study only. Okay, please correct it. Dolls and Hills is not a case control, it is a cohort study. Okay, last couple of questions. Treatment of AIDS ART started at CD4 cutoff. 250, 350, 500, no cutoff. When do you start ART, guys? When do you start ART, everybody? ART is started irrespective of CD4 count. So there is no CD4 count and we will go with TLT. Okay, a patient with category 3 dog bite has come to you, everyone. Received prophylaxis for a monkey bite 6 months back. What is the next step of management? Now over here, remember, this is a case of re-exposure prophylaxis. So in re-exposure, you have to check whether it is within 3 months or it is beyond 3 months. Within 3 months or beyond 3 months. Within 3 months, just wash the wound. ठीक है, सिर्फ wash the wound. But if it is beyond 3 months, now if you see re में कितने letters हैं? 2 letters हैं. तो कितने visits लगेंगे? 2 visits लगेंगे. It is like whatever be the guideline, मतलब it is fixed. 3 months fixed है. Day 0 and day 3. So wound cleaning, rabies vaccine on day 0, 3. Whether you do IMID regimen, it is immaterial over here. But yeah, in post-exposure prophylaxis after dog bite, guys, post-exposure prophylaxis according to National Rabies Control Program in India, we prefer updated Red Cross Thai regimen. Updated Red Cross Thai regimen. Now in updated Red Cross Thai regimen, remember I, India, and D, याद रखो, intradermal regimen. इंट्राडर्मल का डोज 0.1 ml होता है. थाई में 4 लेटर्स हैं, तो 4 विजिट्स. डे 0, 3, 7, 14, day 0, 3, 7 and 28 days. It is given on 2 sites simultaneously. बच्चों को थाई में दो, बड़ों को डेल्टॉइड में दो. दूसरा रेजिमेन इज योर SN रेजिमेन. ठीक है, री एक्सपोजर यू ऑल नो. If you talk about rabies immunoglobulin, remember a couple of things, and day 0 is the first day of vaccine administration. ठीक है, first day of vaccine. Now if you talk about rabies immunoglobulin, you have to remember human immunoglobulin देते हैं 20 international unit per kg body weight, max around wound site. ठीक है, maximum is given around wound site. Immunoglobulin can be given up to 7 days. Up to 7 days from first dose of vaccine. ठीक है, from first dose of vaccine. Beyond that really not needed क्योंकि antibiotics बन जाता है, antibodies. और immunoglobulin जो एक बार दे दिया, you don't need to repeat it again. If not available, okay, if not available in human, then what will you give, guys? You will give equine immunoglobulin. The dose is 40 international unit per kg. ठीक है, and to control dog rabies, what will you give? Vaccinate the dogs. 85% of dog population accessible है, guys. ठीक है, चलो. Pregnant female, please give rabies vaccine. Rabies vaccine is a killed vaccine. All right, rabies vaccine कैसा vaccine है? Rabies vaccine is a killed vaccine. You are not going to forget this. So you will give in a killed, in a pregnant female also. Okay. Pre-exposure is 0-7 days. Yes, of course. So that we've always discussed. No, pre-exposure means veterinarians, forest officers. That is days 0, 7, 21, 28 days, whichever is longer. Now we all know dengue. एक serotype से protection doesn't confirm protection against the other serotypes. And the test to detect dengue, NS1 antigen. All right, NS1 antigen detection test. Okay, just 5 more minutes. What is the answer to this? A school has a small outbreak where children are showing symptoms like runny nose, cough, fever and skin rash. Doctor identified as measles outbreak. Which of the following is the correct time to give post-exposure measles vaccine? Now, I have told you this many times, whether it is a disaster, whether it is an outbreak, measles vaccine, if you want to give, it should be given within 3 to 4 days. It should be given within 3 to 4 days of exposure. Okay? So do you understand this question, everybody? Chalo. Let's go to one more management. An unvaccinated 5-year-old presents with sore throat and difficulty swallowing. The discussion about measles has already been done in the image-based session. Most common complication of measles or otitis media in children, वो हमने already discuss कर लिया, ठीक है? 2 to 2 sites है थाई रेजिमेन में, ठीक है? 1 sites है SN रेजिमेन. चलो, what is your answer to this one, guys? I just wanted to discuss one small thing. See, an unvaccinated 5-year-old patient presents with sore throat and difficult swallowing. तो उसको greyish membrane दिख रहा है tonsils में. तो उसको क्या हो गया है? Diphtheria. Now, she has her vaccinated 2-year-old brother. वो asymptomatic है. What is appropriate management for this sibling? Now, you have to remember one thing. Diphtheria management you can check out from pediatrics, but I have also brought diphtheria management for you today. केस कोई भी जो डिफ्थीरिया का होता है, वी गिव डिफ्थीरिया एंटीटॉक्सिन. इट रेंजेस बिटवीन 20,000 to 1 lakh इंटरनेशनल यूनिट. जैसे बुल्स नेक में वी कैन गिव अप टू 1 lakh to 1,20,000 ऑल्सो. एंटीबायोटिक्स वी गिव पेनिसिलिन जी या ओरल एरिथ्रोमाइसिन. वी डू सीरियल कल्चर्स, ठीक है? वी डू डिफ्थीरिया टॉक्सॉइड और कंटिन्यू इम्यूनाइजेशन इन कन्वेलसेंट फेजेस, ठीक है? वॉट डू यू डू फॉर कैरियर्स? कैरियर्स के लिए ऑल्सो दिस इज अ PYQ. वी विल गिव एरिथ्रोमाइसिन फॉर 10 days फॉर कैरियर्स. रिमेंबर वी डिक्लेयर नॉन इन्फेक्टिव when there are 2 consecutive negative blood cultures. We'll stop antibiotics. But the question which is very important is for contacts. Okay, so for contacts you will give oral erythromycin for 7 days. What about diphtheria toxoid? Now here the sibling is vaccinated, guys. तो एक बार यहाँ पे पढ़ो, unknown status या less than 3 dose taken. You will give diphtheria toxoid and complete the diphtheria toxoid series. You know diphtheria कब कब जाता है? In the form of pentavalent 6, 10, 14 weeks. So by the time the baby is 2 years, the baby has already received 3 doses. ठीक है? यहाँ पे क्या बोल रहा है? He's taken less than 3 doses, you will give a diphtheria toxoid and complete the toxoid series. More than 3 doses and last dose taken more than 5 years ago, you will give a single diphtheria toxoid. More than 3 doses and last dose taken less than 3 years ago, जिसमें your baby is currently falling, no extra vaccine to be given. So what is it that you're going to give to the contact? Now see in this question, guys, ये बच्चा जो है sibling 2-year-old vaccinated है. That means by the time he's turned 2 years, he's already received penta 1, 2, 3. So he's already got diphtheria 3 doses and that too within 5 years. So what are you going to do? You don't need to give anything else. You just need to give a prophylactic dose of penicillin. Is it clear? Everybody do go through the management of diphtheria, guys. These slides are going to be on the PDF. So it is good for you to revise right now diphtheria ka management. We've always discussed about the other management. So rabies ho gaya, diphtheria management dekh lena. I have written over here a small chart, the drug of choice. Carriers ko bhi erythromycin में डालना है और इसको भी डालना, ठीक है? Okay, last but not the least, guys, can you tell me about tetanus management? A young male presents with a clean cut wound without bleeding. He completed a full tetanus vaccination course 10 years ago. What is the best management? SN 0.5. Difficult नहीं है बच्चा. There are cases, carriers, contact. Cases का पूरा इलाज करो. कैरियर्स को ड्रग भी देना है, वैक्सीन स्टेटस देखना है. कॉन्टैक्ट सबसे ज़्यादा चांस है एग्जाम में आने का. This I am sure everybody can do. Single dose of tetanus toxoid. You just have to follow this protocol. Remember one thing, unclean wound में ही you are going to give immunoglobulin. ठीक है? In the unclean wound you are going to give immunoglobulin, guys. Full immunization within 5 years, clean, unclean, only wound care. More than 5 years, less than 10 years. Wound care plus TT single dose in unclean also, but more than 10 years you will add a immunoglobulin in unclean. Diphtheria, tetanus, rabies, ये पढ़ के जाना. इसका आंसर क्या है? टाइफॉइड ट्रांसमिशन कम्युनिटी में रोकना है. व्हाट इज योर आंसर गाइस? टाइफॉइड ट्रांसमिशन इफ यू हैव टू stop in the community, I'm just going to give you person to person hygiene and sanitation measures. Okay, okay, now last thing, we have certain charts, guys. Please revise the chart number 1. This is what chart? This is a rickettsial chart which you should revise from here. This is a rickettsial disease chart जो तुम revise करोगे. This is important. इसमें orantia group देख लो. शुटशु गमूशी drug of choice doxycycline होता है और यहाँ पे एस्कार बनता है. ठीक है? Do revise epidemic typhus agent, vector. They do come in your exams, guys. Drug of choice rickettsial diseases के लिए doxy है. Another chart which I have compiled in the PDF, degree of dehydration, 3-star chart. Management of diarrhea आप अपने बुक से कर लेना. ठीक है? Degree of dehydration यहाँ से देख लो. Mild, moderate, severe they give you in the exam. So you can go through this, like you wanted to see tears absent in moderate severe dehydration, eyes वगैरह आपको देखना है. lethargic baby severe में होता है. ठीक है? Then you have thirst, severe में unable to drink, so do go through this. Urine output gets reduced from moderate as well. So go through these diarrhea management plans. Also go through this one. Incubation period का slide you will find over here. I just wanted to keep it in the PDF. A couple of incubation periods that you should do, guys, for your exams. इन्फ्लुएंजा कभी कभी पूछ लेता है. पीरियड ऑफ आइसोलेशंस यू कैन डू कब कब है. वन मोर थिंग मोर इम्पॉर्टेंट दैन दैट इज द पीरियड ऑफ कम्युनिकेबिलिटी. एवरीबडी ठीक है? वो पढ़ लेना. दिस लोगो आई हैव डिस्कस्ड इन योर एग्जाम. दिस इज इमेज बेस्ड नेशनल क्वालिटी अश्योरेंस इमेज, नेशनल क्वालिटी अश्योरेंस प्रोग्राम. जैसे लक्ष्य हो गया, सकुशल हो गया, मुस्कान हो गया, ये सब नेशनल क्वालिटी अश्योरेंस में आता है. Last thing, all the important days and dates I have mentioned for you, so do go through these days and dates also. It will be in the PDF. जैसे नेशनल deworming डे कब है, वर्ल्ड डायबिटीज़ डे कब है, नेशनल कैंसर अवेयरनेस डे कब है, you never know, they can ask you in the exam. Alright, so that's it for today. Yeah, one more thing, last thing that I wanted to discuss over here, guys. STD kits. Everybody remembers STD kits. STD kits में कितने किट हो गए? STD kits, how many kits are there now? You all know the update for STD kits. STD kits में 8 kits हैं. The last kit, guys, is the brown kit, kit number 8. I have discussed in LRR. It is for anorectal discharge. Okay, so do go through your STD kits one. And the last thing that I wanted to also tell you was all the latest value, guys. So remember the latest values which could come in your exam, like the latest MMR, ठीक है, maternal mortality ratio 93 per 1 lakh live birth. Okay, IMR latest is 27 per 1000 live births. ठीक है? उसके बाद हो गया तुम्हारा क्रूड बर्थ रेट, गाइस, 19.3 पर 1000 लाइव बर्थ्स. क्रूड डेथ रेट लेटेस्ट 7.5 पर 1000 लाइव बर्थ्स. एनुअल ग्रोथ रेट एवरीबडी कंट्री का इस पॉइंट 1.18 है. पॉपुलेशन इंडिया का कब डबल होगा? पॉपुलेशन डबलिंग टाइम. आई विल मेक एन इमेज फॉर दिस एंड शेयर इट ऑन द ग्रुप्स एज वेल. 59.32 years. So these are your updates. Clear? Everybody, did you understand? Current global hunger index कभी कभी पूछ सकता है, guys. Global hunger index अभी इंडिया का 27.3 है and India is in serious level of hunger अभी. ठीक है, सीरियस लेवल हंगर, इसका रैंक जो है, कभी कभी आई गेट दिस रैंक, 105th रैंक इंडिया का है। HDI you already know the rank. What is the HDI rank currently? 1.644 is this thing, and rank is 134. Okay guys, so this was it for today. I know it's a little big session, but tomorrow you'll have the class at 12 p.m. only. So I'll see you all tomorrow. Do go through this guys, it's a very important class today. इसको do share with your friends and everybody. इसको रिवाइज ज़रूर करना. Any other question, I will tackle it when you meet me again tomorrow. ठीक है, सो थैंक यू सो मच, हैव अ गुड डे, कीप रिवाइजिंग गाइज. बिल्कुल टेंशन मत लो, थोड़े से दिन पड़े हैं. दिस टाइम इट यू कैन डेफिनेटली डू इट, आई एम श्योर ऑल ऑफ यू आर ट्राइंग. सो जस्ट हैव द फेथ इन यू, हैव द कॉन्फिडेंस इन यू. आई एम ऑलवेज देयर विद यू. कलर कोडिंग न्यूमोनिया का सेम है IMNCI. सी IMNCI के अकॉर्डिंग ग्रीन कलर होता है होम, ठीक है, होम. येलो कलर होता है, इट इज़ OPD मेडिकल ट्रीटमेंट, एंड पिंक कलर होता है रेफरल. ठीक है, चलो बाय बाय. लेप्रेसी टीबी HIV, वेक्टोबॉर्न, रेपीज, STD, डायरिया, डिफ्थीरिया, न्यूमोनिया श्योर शॉट है. कुछ तो आएगा ही आएगा. ठीक है, चलो, थैंक यू सो मच, बाय बाय, हैव अ गुड डे.